Alrighty. Hello, everybody. Welcome to another Fireside Chat. Once again, I'm David, president of CAPS and BAPS, Columbia Association of Predental Students with Barnard Association Predental Students. We're joined today by Raya Hakakian. Thank you for being with us. Raya, would you like to introduce yourself?
Sure. Thanks for having me, guys. My name's Raya Hakakian. I graduated Barnard in 2019, and I'm now at D1 at NYU. That's really what there is to me.
All right, so we kind of like to start it relatively basic with, what made you want to be a dentist? What made you want to go to dental school?
Sure. I guess my whole life I've kind of been like in and out of the dental chair. I've been like a perennial patient forever. So it really was very comfortable to me. Had no traumatic experiences, which was great. And it transformed, like I used to be very shy. I had a lot of discomfort with my mouth, and it caused a lot of other problems, eating, speaking, things like that. So to me, like I got the best outcome from the field. So I've always had really positive associations with it. And then learning more about it, understanding connections between like systemic and oral health, it kind of just seemed like something that I wanted to explore and be able to like bring to other people. And then in general, I love working with my hands. Seeing things that I can do with my hands is great. So it just seems like a great integration of all those things.
That's awesome. I've found that a lot of times when people speak with us, it's either that they had, great experiences and, it was like, oh, dentistry saved me when I was a kid or I had a family member or something like that. Or it's like the complete opposite where it's like I had terrible experiences and I wanted to, make it so that never had to happen to anybody else again.
Yeah.
So yeah. Now, another thing we like to kind of kick off with, kind of to get started with our questioning is, you said you're a D1, you're towards the beginning of your dental school career. What was that transition like, with going from undergrad to dental school? And can you just tell us a little bit about that?
Sure. So my transition is a little unorthodox. I took a gap year and then it ended up being a global pandemic, so it got cut a little bit short. But I had a few months where I worked in a dental office in Tribeca, which was really awesome and a great experience. And then I started dental school this past summer. I would say in terms of like academic rigor, I don't think it's the steepest departure, especially like Barnard Columbia community and like academics kind of set you up really well for dental school. By the end of it, you're a pretty good studier. To succeed, you need to have really good time management, things like that. I would say the biggest thing is being able to time manage your time in actual courses and in lab, because you're not spending as much time taking didactic courses as you used to be. You're doing that as well as working in the lab, learning preps, things like that. So I would say that was the steepest departure. And then you kind of have to make the adjustment from being a student to being a professional. You're really not a student anymore. You're kind of like working a job, which is crazy. You don't get to make your own schedule like you did in undergrad. They tell you where to be and when to be there, and you just do it. I think it's like a step up. You just have to become a little bit more professional. You have to maintain a little bit more of an air of professionalism. But other than that, academically, I don't think it was a steepest departure.
Do you like that kind of more, job-minded attitude that comes with dental school, or did you prefer more, or do you prefer more of the academic sides of it?
I definitely think it has its pros and cons. I think it's great that they integrate you into the professionalism so early, because eventually when you graduate and you become a dentist, that's what you're going to be doing on a day-to-day basis. So it's really great to learn the responsibilities of it early on. It's just a really weird transition because you're still in school, and you're taking classes and taking tests, so you treated like a student. So it's a little bit of like a limbo, but I think it's beneficial for sure.
And what are some of the challenges that might come with, being in dental school? Is there anything that, maybe popped up as something you didn't think would be, challenging and was, or is there, something that you're just like, oh man, this is kind of a little rough to get through?
Sure. So I think definitely you're taking a lot more courses at a time, and they're really, really dense, which is wild. And your schedule is a little bit different in that it's rolling. I guess I don't know if this is specific to NYU, but classes start and end at different times. So you're constantly picking up, starting. So you don't really have like a defined semester, I guess. You do have your breaks, but your classes kind of integrate. Some roll over, some end earlier than others. So that was a little bit weird to navigate. And then again, I think the biggest challenge that I didn't anticipate coming was just the professionalism. You're expected to act a certain way. You're really held responsible for your actions, which is especially like today in the age of COVID. Your online social media presence is like super monitored and super important because you're part of a larger healthcare community now, and people look to you as an example. So I guess kind of navigating your social life and what you really want to do, and also being responsible is a challenge. And then I guess really it's just all about the balance. So like being able to balance your social life, which is important to maintain, your lab work, your hand skills, and also your didactic courses. It's a lot of juggling.
Is it pass fail NYU?
No, ranked.
Would you be able to tell us a little bit more about that kind of juggling everything, how you're able to, keep it all together?
Right. So it's really about time management. And you have to acknowledge that, you're not going to be studying 24/7. So you need to give yourself those times where you take your breaks, where, you give yourself time to recuperate, or you'll fail in every other aspect. And then is taken less seriously because you're not technically like graded right off the bat, but I think recognizing that that's essentially your future, doing the preps, fillings, things like that are essentially what your patients will pay you for, and what people will determine your scale based on. So I think understanding that that's really important kind of helps you maintain like its prevalence and give it the attention it deserves. But other than that, really plan ahead. You're given your schedule generally pretty early. Allot the time, manage the time, don't procrastinate. I would say like a lot of the time, stay on top of your lectures as they come. Don't cram before a test. That's really important. Also, because a lot of the knowledge is integrative, so it'll like ebb and flow between courses. So you can't really compartmentalize. So just staying on top of things, making sure that everything stays relevant.
I know one thing you mentioned just a minute ago was that you weren't sure if something was unique to NYU. Um, is there anything that you want to talk about that is unique to NYU? What makes it special? What kinds of things are, different, between NYU and any other school?
Right. So I think the biggest thing is the class size. NYU has like a giant class size. I think we're like 350 in any given year. Totally has its pros and cons, 100%. I know when I was deciding between schools, it was really a deterrent for me that it was such a large class size. I ended up having other factors that kind of weighed more, but now that I'm here, um, I think the benefits of the large class size are that you have a lot of different personalities, a lot of diversity. You have people in all walks of life. You have older people in their 30s who took a couple masters and really wanted to like master oral health and then came to dental school. You have a couple people who had career changes and went from being a lawyer for 20 years to now being in dental school. You know, I think it's very representative of the people you'll meet in your future as a dental professional, which is great. You know, you can forge connections now, because ultimately when you want to refer people out as a professional, a lot of your connections will come from people who you're classmates with. So I think having a large selection is great. It does get a little bit easy to get lost in the shuffle. So if you're not one to distinguish yourself as a person, you might want to become one to distinguish yourself, making connections with your professors, things like that. The organization of NYU also, what they do is within each class, so within the D1s, they separate you into like a group practice. And you have a group practice director, which is one of the professors, and your group of about 30, your smaller group, and you guys are kind of aligned. Your schedules are pretty similar. You go to lab the same days. So that makes it really easy to get individual attention, because you'll be like 30 people at a time. And you also have like a really great support group of people that you're spending 4 years with. You know, they're your friends, they're your colleagues. So I think NYU does a really good job at that. Also, because NYU is such a large organization in general, a lot of people come to the clinics. It's really well known. We're associated with Bellevue and Langone and things like that. So it's pretty interesting to see the types of patients that come in. You have really diverse patients, and you have a very large patient population, which is great when you have to get graduation requirements in.
So, oh, Malky, you can go ahead.
What are graduation requirements?
Graduation requirements. So I know that most schools do this, but I think they do it a little bit differently. At one point, you get tested not only on like material, but you'd be tested on work you do in labs. So someone will sit down and watch you drill, prep, and fill it, and grade you on how well you did it. So to graduate, you have NYU does it by like a certain amount of things you need to do. So let's say you need to do 3 crown preps and 2 root canals and blah, blah, blah. And if you don't finish them, you cannot graduate. Other schools do it based on like, you need to be signed off, like you did this to a certain degree of excellence, things like that. So you have to like have patients in clinic to kind of be able to fulfill these graduation requirements so that you can graduate.
So why does a bigger like class help fulfill those?
So not necessarily a bigger class, but the fact that you're in New York and you have a really big patient population. Because in other schools that aren't necessarily like in the heart of New York City and associated with a lot of other places, it's a little bit harder to get patients.
That kind of actually brings me into another question, which is, when do you start seeing patients? What's the year-to-year progression like? Because I've heard that NYU, you get to start seeing patients pretty early on.
Yeah, so it's a little bit out of whack with COVID, but generally, your first year is kind of, you do academic classes and you're in the lab with your classmates. You're in what they call sim labs. So you have a mannequin head on a stick with some fake teeth, plastic teeth in there, and you just work on those. As you progress, you get a little bit more exposure. So I think like mid D2, beginning of D3, you start to assist. So you'll assist like D4s while they work on their patients, but you're actually seeing a patient here. You're in the patient's mouth. You're learning patient-side manner, how to speak to them, what's comfortable for a patient, ergonomics of like treating a patient. So that starts pretty early. And then by mid D3, you kind of start your clinical rotations. So you'll go to like perio, orthodontics, prosthodontics, pediatrics, things like that. So then there you get to see patients and also be exposed to the different specialties. And then by D4, like you have a roster of patients, you're treating those patients, you're getting those graduation requirements in on real patients. So it's like a slow integration to the point where by D4, you're comfortable, you're a patient's dentist at that point, which is really cool.
Do you want to specialize?
I think so. I get mixed reviews. Everyone's like, you never know until you really do the rotations. As of now, I think I am leaning towards like perio or oral surgery. But after working in a general dentist office, there's a lot of variability like in your day to day, which is really interesting because you can literally do anything. And a lot of people will come to a general dentist and only go to specialists if referred out. So like in the practice I worked in, we did a lot of like veneers, crowns, implants. So kind of got to do everything, which was awesome. But I guess I'll decide when I go on my rotations.
Do you know if like a lot of people from NYU specialize? Like, is it common, or are most people general dentists from NYU?
So most are general dentists, but I think from any class, the largest percentage is always general dentists. But people definitely do. It's a little bit more competitive, to be like super honest, because you're competing against 300 other people rather than like a smaller class where you'd be competing against like 60 other people, you know? But a lot of times also like professors that you work with write you letters of recommendation, things like that. So the fact you have a big network can help too, you know?
It's funny, Malky asked the question I was about to ask about specialization. So as far as, again, with specializing, do you think that at NYU, the fact that you get to see patients maybe a little earlier than at other schools, that might help? Or do you think it's just, about the same?
I do think it helps. I think any exposure you have, because you really don't know exactly what anything entails until you're like head first in it. So I think the sooner you gain exposure, the sooner you can kind of like form an opinion, determine its feasibility, you know. So I think like the earlier exposure is great, and also it kind of just refines your skills to a greater extent, regardless. So like even if you were to stay general, you have a little bit more experience in that sense, which I think is nice.
And then earlier you mentioned how your classes have been affected. You mentioned how classes were affected by COVID. Would you mind just telling us a little bit more about that? What things have changed as far as, I know you had said it in regards to seeing patients. So, what kinds of things have changed for you?
Sure. So we're actually like almost completely online. We take all our classes online all the time. We go into lab once or twice a week for 3 hours, where we do like preps, composites, things like that. I think they're slowly trickling us back in, but we are not really the highest priority right now as D1s, you know. D4s are really almost back to normal. A lot of them have been given the vaccine. They're seeing patients to like the greatest extent possible because people need care and they need to graduate. D3s are a little bit less so, but they're in there pretty often. And then I think like D2s and D1s, they're kind of trying to navigate us, but working on it. I wish I could give you more information. They don't even tell us our schedule until like a month in advance. So just going with the flow.
Gotcha. And as far as lab, I know you said it was, I think you just said it was sim lab. Do you guys I'm assuming that means like anatomy labs are all online
Yeah,
as
so we did
well.
anatomy lab online.
So,
It was sad.
so no like dissections, I
No,
guess.
I mean like they did go into the lab and take pictures of like every plastination ever. And they said like this is great because we get to show you exactly what we want to show you in the pictures. But talking to other people, I don't know, I guess there's something to be said for seeing like the physical thing, you know.
And then, as far as I know a little bit earlier, just to backtrack again, sorry.
No, you're totally fine.
As far as your, I think you said they were called group practices. Does that, how does that work as far as like support systems? I know you had mentioned that you have a bit more one-on-one attention from faculty. Can you just talk a little bit more about that?
So the way they do it is they split us up into 2 days. So half of our class goes into lab on, let's say, Tuesdays, and the other half of our class goes into lab on Thursdays. And each like group practice is given their own designated area. So like a certain floor, and you're given designated faculty. So every week I go into lab and I have my designated faculty. They know me, they know my progress, they know where I'm at. If I have questions, I can ask them, they can come over. So rather than being in like a larger group where you have faculty roaming and having to deal with like 300 people and learning 300 people's names, you have your designated faculty, your 30 names, they know you, they know your progress, which is really nice. And it just also, like, within your classmates, it's really hard to forge relationships when you have such a large pool, but this way they kind of like narrow it down for you. They're really great. A lot of people live in my GP, like even live together now. They study together. It's just like nice to have people to refer back to when you need it.
And how are those determined, the group practice? Is it just random selection?
Yeah, they're randomly assigned to you, and you get a faculty member who oversees you. And yep.
And as far as, with administration as well as the faculty, I know that in having heard from a couple different students at different schools in the past, some have said some schools, not to say handhold, but, are a little bit more just go off and learn. What's the experience at NYU like, in your experience?
So it's pretty much go off and learn, and if you have questions, ask them. Nobody is like checking up on you as you go. You basically have competency practicals, which are your exams at, like, at the point, and they say, all right, do this prep right now. You have 45 minutes. Let's see. So leading up to that, nobody's really monitoring you so much. You have like sign-offs where a professor will like glance at it and make sure you did what you were assigned, but nobody's really like checking the depths, checking your margins, things like that in such great detail. So like my advice for that is ask, because before I leave lab every week, like I'll have my professor come over and like measure everything and tell me exactly what he thinks. But some people will just, do it and leave. So it's a matter of preference. You can make whatever you want of it essentially, which is good,
Definitely. And then with that, is it as far as kind of like doing practice for those sorts of things? Because I having spoken to dental students in the past, some people will be like, oh, I was up all night practicing in the lab to make sure X, Y, and Z was perfect. But if you can't do that with COVID, what does that kind of look like now?
Right. So generally, I think our sim labs are open like basically all the time outside of COVID, and you can go use everything as you please. Now we're kind of, they give you the 3 hours, and you do what you can in the 3 hours. They are working on getting us more time in the lab, which is nice, but regarding practicals and things like that, I think it's just really make the most of your time. And then I think that their plan is that as we trickle in person, they kind of shifted our schedule. So now we're taking a lot of classes that people normally take during D2. And I think that as the school opens a little bit, they'll kind of shift us more towards lab and less towards didactic, because we've taken the didactic courses already. So that's what we anticipate happening. We're reassured that by the time we come to graduate, we will have had as many hours with a drill in our hands as anybody else. So.
And then what's your favorite part of dental school? Your favorite thing that, it could be something that you've learned or experienced. Sorry, there's a clock next to me. But what's your favorite thing?
I definitely really like lab. It's interesting because I think in undergrad, it's like pre-dent, you're preparing for dental school and you're preparing for what's to come, and then you study for your DAT and like you're preparing and you're preparing. But I don't know, I never found it directly applicable until I sat with like the drill in my hand. I'm like, wow, this is what I'm going to be doing to my patients, and just seeing that I can apply like margin outlines and like certain depths and then actually translate them into like a physical product it's really fulfilling. So I would definitely say like being able to do hands-on work is my favorite part.
A question again. Before you mentioned that you were a dental assistant in your gap year. So did you take like a course to become a dental assistant, or that like you don't know course required?
So there is like certification to become a dental assistant. You don't need it. It depends on like the doctor's hiring. I think the really like from my experience, the only thing that I've noticed is really different is like the amount of like pay you would necessarily get. But if you work with someone accommodating, like I learned everything in my first 2 weeks on the job, and then it's a learning curve. You learn as you go. So I found it really, really beneficial to work in a practice before I came to school, because a lot of things that come up in lecture, like radiographs, reading x-rays, things like that, taking x-rays, how to position the film. Learning it in the lecture is not the same as doing it, and you're not really given the opportunity to do it till much later. So kind of coming in with a little bit of experience before you start's really great. Understanding like the steps in placing a composite, things like that. It just kind of gives you like a very strong foundation to work off of. So I really recommend.
And then one thing we usually like to ask, from our formal questions is, one of the last formal questions we ask is, as far as, your experiences, is there any advice that you would have to give to pre-dental students, looking forward towards their, future academics, future careers?
Yes, absolutely. Shadow, assist, practice, get into an office as soon as you can, expose yourself as early as you can. There's even like kits online. Actually, I think mine's on my desk. Yeah, there are like kits online that sell like mouths and like fake drills and like mirrors, and they kind of just let you practice your positioning before you start. Do all of it. Like nothing is too much. All it'll do is give you an upper hand and make you a little bit more comfortable, because to be honest, it's like a super weird adjustment, because in 4 years time you're going to be a professional responsible for somebody else's health. And jumping for the first time I sat down with the drill in my hand, I was like shaking, and my prep came out horrible. Like I couldn't even start. It took me like 45 minutes to like touch the plastic tooth. So as soon as you can get integrated and get in and start, it's never too early. Like do it.
And then one other thing is, if you could travel back in time and give yourself one bit of advice, what would that be?
I guess it'd be for my interview process. You were interviewing schools as much as they are interviewing you. So like, don't forget that. You obviously want to get into like great programs, but you also want to go to the place that will like be the most conducive to your learning, because it's stressful, it's hard, it's like a big commitment. You want to be somewhere for 4 years where like you will be comfortable, you'll be happy. Whether it's like proximity to home, if that's something important to you, like keep all these things in mind. Proximity to home, in super rigorous notes during my interview process. I was just scared about making a good impression and getting into schools. And then when I had to choose where to go, I was like, oh, okay, now I have to backtrack and do all the research. They give you everything at your interview. They tell you everything you need to know, ask questions. You're making a decision about them as much as they're making a decision about you.
As far as, a question that kind of just came up for me as we were talking here is, with the interview, could you just tell us a bit more about what interviewing at schools was like? I know that as far as the application process, that's one of the points that people always highlight as like either, wow, it was really nothing, or, oh my gosh, that was, really crazy. I got grilled by the interviewers. So would you mind just telling us about, what you experienced?
Sure. I think in general, it's not a terrifying experience. as you go through more and more of them, you become a little bit more comfortable. But because the application process is rolling and admissions are rolling, you show up to your interview. I think there's like 15 to 20 other people who are interviewing on the same day. And then depending on the school, either before or after your individual interviews, take you on a tour, have a little bit of informational sessions. Those are really important. Like, again, pay attention to those, write your notes. Not kidding. And then you kind of are sitting in a big room, couple interviewers come in and pull you out one by one, and you go and you have your personal interview. They generally tend to be super conversational. I only had like one really like wild experience where like she had sticky notes on my application and she was like leafing through and like asking me specific questions. Your applications are a reflection of yourself, so like you're fine. I do recommend, no matter what, just skimming through your application really quick before each interview, because sometimes you submit your application months before you get an interview. You don't remember every single thing that's in there. So just skim it. That's also another piece of advice. But generally, they're pretty conversational. They want to make sure they get to know you as a person, because all that's not what your interview's about. It's kind of understanding, like, are you going to be an empathetic dentist, or your patient's going to feel comfortable around you? It's just, is this someone that we want to have our name on as she or he enters the professional field? So just like being yourself, being professional but relaxed, personable, I would say, is really important. But they're not really stressful. You got an interview, which is a good sign usually.
And then another question I had, which is kind of completely unrelated to interviewing, is, in dental school, what's like a day in your life as a dental student like? If you wouldn't mind just telling us a little bit about that.
Sure. So our schedules are predetermined, and they really are different basically every day. Generally, we'll have class from like 8 to it ranges on the day, sometimes 8 to 12, sometimes 8 to 2, sometimes 8 to 4. So you'll go through your classes. You generally have like 2-hour blocks of classes. You'll have a lunch break in the middle, and then you study a lot. Review your materials. You usually almost always have an exam, even if you don't review your materials. You're always doing something. You have a lot of quizzes. You're taking a lot of courses at the same time. So you always have like an assignment or something to do. And then I guess if it weren't COVID times, I would be in the sim lab, but that's it. I usually study. And then, you go to lab once a week, get your work checked up on, and then that's it. You go to class. A lot of people watch recordings after the fact, which is like podcasting, which is really, really, really helpful. So like most professors will record classes. I, a lot of the times, will like watch a class the first time and then later that night or the next day kind of like listen again, write extra notes. Sometimes if like I have something to do and it's not attendance based, I won't go to the class in the first place, and then I'll podcast it later. But generally you're just like inhaling information. That's pretty much it.
Does anybody else want to jump in and ask anything?
I have a quick question, Raya.
Hey.
Do you have any tips or advice for like anything you wish you would have known about the application process, either like in general or maybe also like specific to Barnard?
Ooh, okay. The committee letter is like a really good trial run. Treat it like, take it seriously, because honestly, I found it a little bit more intimidating than real interviews, but it's good. You get people in front of you asking you about yourself. You get comfortable talking about yourself, knowing which strengths to play up, which weaknesses to play down, things like that. I guess you're coming from pretty high standing coming from Barnard, but I wouldn't say, or Columbia for that matter, I wouldn't say that you should necessarily feel complacent ever. You're competing against people who are doing are coming from all different walks of life, people who have like super strong connections. It's not about your numbers anymore. It's really about your experience and what you're gonna lend to your patients. I think is like super important, and what you're gonna give to the community, because a lot of programs besides NYU were super small. I think Stony Brook has a class of like 40 people. Columbia is like 80, something like that. So they want to know like what you're gonna contribute to the community at large. So I would say kind of like knowing what makes you individual, what makes you different than like other people is super important, because there's a lot of people who have a lot of the same statistics and things as you. Like sit down and like really like write your strengths, write your weaknesses. Like it's really important. People will ask you in interviews. And one piece of advice someone gave me is like when they ask you, what's that question, like your weakness, and everyone says like, say a weakness, it's really a strength, like a perfectionist, or like, I don't recommend it. I've known people to get called out for things like that, because like you're trying to make yourself sound great, but like also not. I would say like a real weakness, I remember I said that like I tend to get like really overworked and very stressed. A real weakness, like not something that's like, oh, I want her in my program because she gets stressed. But then they ask you how you overcome it. So being able to problem solve, I think, is also very important.
Anybody else have anything they want to ask? All right. Well, that's all I had. So thank you, Raya, so much for speaking with us and, telling us about your experiences, giving us advice. It was really great to be able to talk to you and to learn more about NYU and dental school as a whole. So thank you so much.
Thank you.
Of course, if you have any questions, don't hesitate to reach out. It's like a weird process, so.
Thanks.
Thank you.
Thank you.
Bye.